Well, Republicans are now stepping up efforts to find answers about the rocky rollout of Obamacare and the website and who exactly is to blame over this. The senior Republican on the Senate Health Committee, Lamar Alexander, just released this statement saying, quote, "Somebody must be accountable for this mess. And if the president isn't going to resign, it's up to him to figure out who should." Some interesting words from Senator Alexander, who joins us live now from a great city in America, Nashville, Tennessee. Senator, it's nice to have you on the program.
Good morning.
So let's talk a little bit about Obamacare. There's a couple things to discuss with you. Who do you think is to blame over this?
Well, the president first, and as I said, if somebody needs to be on the flagpole for this, and somebody ought to be fired. If the president's not going to resign, he should fire somebody else. I mean, what we have right now is millions of Americans who are being told they have to buy insurance by December 15, have it in place by January 1 on a website that doesn't work, or be fined by the Internal Revenue Service. Now, that's completely unacceptable.
So do you think it's Secretary Sebelius that should be fired?
Well, that's up to the president. I think he should make that decision.
So in the meantime, you would like to introduce a bill that serves almost as a weekly report card, if you will, about Obamacare.
Yeah.
Tell our viewers a little bit about what you'd like.
Well, we want to know what's happening on the exchanges. Number one, how many visitors? We hear that half of 1% were all that were successful in the first week. We'd like to know how many are successful. I'd like to know what level of insurance they bought, what their zip code is. That ought to be information in the internet age that's available every single day. And it's Congress' job to have oversight of this program because, as I said, people are expected to buy this insurance by January 1 or be fined by the IRS.
Have you asked the administration for this information?
Yes, I have. I've asked the administration for a lot of information. I get no answers at all. And so we're going to introduce a law next week when the Senate reconvenes, and we're going to force it.
Maybe their email isn't working, as we're seeing some of the technical problems.
Well, emails, telephones. I mean, let's think about this. This is the internet age. Even before the internet age, McDonald's could tell you how many hamburgers it was selling every day. I mean, if the administration were rolling this out properly, what it would do is report every day on how many people visited, how many were successful, what their zip codes were. So they would be proud of their new health care law. Well, so I would expect the Senate Democrats to help me join in oversight of this law, and let's have some information about it.
So let's talk a little bit about the Senate Democrats. There was a closed-door briefing with a few Democrats on Capitol Hill today. They emerged from that briefing and said, we're encouraged by what we've heard from the administration about the improvements they're making to the website. So have you spoken to any of your Democrats, your Democratic colleagues on the Hill, and whether or not they get behind a bill like the one that you're proposing?
No, I haven't. We're all spread out all over the country this week, so we'll be back on Monday, and I'll do that. I would think that since Democrats passed the law, they'd want people to know how it's working. And if it is working better, let's let them know it's working better. I mean, this isn't really complicated information. How many people tried to sign up? How many were successful? What zip code are they in? What level of insurance did they buy? Here in Tennessee, people are finding when they get on that their individual insurance might cost twice as much as it did before. Their family insurance might cost twice as much as it did before. That's important information.
Just a real quick final question for you. I was taking a look at some of your resume of what you've done in the past, and it was interesting to learn that you had set up with your wife a business where you helped provide childcare at corporations, at different businesses, and that company was very successful. It became publicly traded, and now it has merged with another huge company. I know childcare and healthcare are not necessarily the same thing, but obviously you found a winning formula for how you provide care for people. And I'm just curious, based on your private sector experience, what do you think would actually work here?
Well, the experience is that do as much in the private sector as you can. That company, which is now called Bright Horizons, is the world's largest provider of worksite daycare. Met a real need. Women working away from home, they take their babies and their youngest children to work. And so what we did was we helped private businesses do it. And of course, if we were selling that product, we were always telling them, here's what we've done before, here's how many were successful. Here are the places where it was. That was a part of our sales pitch. That's what made it successful. So if you want this bill, if you want this program to be successful, this health care law, tell the American people how it's getting better, if it's getting better, or if there are problems, tell how those problems are being fixed. If not, all this secrecy, this business of telling health insurance, don't even let the people know how many people are signing up. That breeds lack of confidence in what you're doing. It's not a winning strategy. Wouldn't work in the private sector.
Very interesting perspective for us. Thank you for letting me delve into your past a little bit there before
well, thank you for remembering that.
It's very interesting. I have a lot of further questions for you, but we'll leave those for another time. Senator, great to see you. Thank you.
Thank you.